This video is presented to you by the 3rd year BSc Nursing students, in cooperation with the Child Health Nursing Department of Bishop Benziger College of Nursing. Today we are going to talk about regression in children. Most children have a very strong urge to forward in their development. There is a natural energy in children to explore, manipulate and master their world. Regression can vary, but in general, it means acting in a younger or needier way. We can see more temper tantrums, difficulty in sleeping, or eating or reverting to more immature ways of talking. If a child has achieved something like getting dressed by herself, you may see a loss of some of those skills. It is also very common when children are adjusting to new situations, like becoming an older sibling or going to preschool for the first time. So, what is regression? Regression is a process that occurs when a child revisits an early stage of development and behaves accordingly. It is very common in young children and usually happens when they feel overwhelmed by an impulse or life event. For example, thumb sucking can be one such habit. On an average, most of the children stop this habit by the age 4. Although there are some children, who continues the habit to as late as 12 to 15 years. In these children, thumb sucking is usually a way to relieve the frustration of hunger. Now we are going to look into the signs and symptoms of regression. It includes loss of the ability to bath oneself, loss of ability to feed oneself, loss of ability to dress themselves, loss of ability to walk, loss of a child's ability to use words while speaking, loss of interest in playing social games, loss of social skills, which includes loss of ability or desire to play, loss of child's ability to understand speech and sounds. Moving on to the management of regression. The management of regression includes physical therapy, speech therapy and social skill training. Physical therapy. It can be used to treat regression of gross motor skills. A physical therapist can help a child with skills like walking or mobility issues. It improves their fine motor skills and hand-eye coordination so they can complete basic life tasks like bathing or feeding themselves, and fine motor skills like writing. Speech therapy. It is used for treatment of regression of language skills. A speech therapist will help a child restore as much of their lost language skills as possible and help the child learn to communicate, potentially using communication aids. Social skill training. It is used to treat social skill regression. Children who receive social skills training are taught age-appropriate social skills like problem solving and peer interaction skills. So till now we have discussed about the definition of regression, signs and symptoms, and its management. So concluding our topic, some regression can last for a few weeks, but it varies from child to child. Usually, if you can pinpoint what might be going on and provide child with support, they will be able to work through it. If it seems to be lasting longer than you think it should, around 2 to 3 weeks, reach out to your child's health care provider. But mostly developmental regressions are short-lived. Thank you and have a nice day!